Cervical spondylosis is a degenerative spine disease found universally in a person over 50 years of age. It occurs early in a person with white collar job because of the neck constantly in a one position during reading, writing, etc. It begins with degeneration of disc. This leads to reduction of disc space and peripheral osteophyte formation. Involvement of post-intervertebral joint leads to pain in neck. Osteophytes impinge nerve root and leads to radicular pain in the upper limb. This osteophyte rarely may press spinal cord. Pain and stiffness. Initially, it is intermittent, but in later stages, it persistent. Radiating pain. Nerve root impingement leads to radiating pain. Paraesthesia. It is over the region of the nerve root which is compressed. Weakness of the upper limb. Rarely occurs if spinal cord is compressed. Giddiness. There may be an episode of giddiness because of verticobasilar syndrome. Cervicogenic headache. Occipital headache may occur if the upper half of the cervical spine is affected. Loss of normal cervical lordosis. Neck movement limitation. Tenderness over cervical spine and muscle around it. Radiculopathic pain in upper limb. Motor weakness, which is uncommon. X-ray of cervical spine shows narrowing of intervertebral disc space and osteophyte formation. Medical management includes analgesics, cervical collar, traction to the neck, antiemetics, or surgical decompression if the spinal cord is compressed by the osteophyte. In physiotherapy management, preventive measures has an important role that include postural habits and the pillow which patient used should be of 7.5 to 10 cm thick. Number 2. Pain management. Some of the following modalities should be given for pain relief: shortwave diathermy, cryotherapy, TENS, hydrocollateral pack, and IFT. Massage and cervical mobilization can also be given to reduce the pain. Mobilization can be of Maitland or Mulligan mobilization, which is very helpful to reduce the pain. For improving muscle power, the following exercise should be done to improve the muscle power: isometric neck muscle exercise, chin tuck exercise, shoulder girdle exercise, scapular muscle exercise, and active neck movement. Number 4. Traction. Cervical traction should be given when the pain and spasm are associated with the radiculopathy. Traction should be intermittent. Isometric neck exercise must given after the traction. Sleep in straight position if possible. Use a thin pillow. Regularly check shock absorber of vehicle. Use smooth roads. Try to maintain erect position during work. Do not take one position for a long time. Take a rest or do movements in between. Rest elbow and arms on chair support while working on the computer. Wear cervical collar while traveling if the pain is more. Prefer train journey instead of bus journey. Wear warm scarf in cold days. Don't put hands under head while sleeping. Do not lift heavy weight. Do not do any stressful exercise. Do not use cell phone continuously. Avoid bus journey.